Imagine going to the doctor for a routine procedure, and someone deliberately poisons your IV bag. Sounds impossible, right? But in Texas, one trusted anesthesiologist did exactly that. Not once, not twice, but multiple times, just to cover up his own mistakes. This is the terrifying story of a doctor who turned the operating room into a death trap. Raynaldo Ortiz Jr., 58 years old, was an anesthesiologist in Dallas, Texas. He had a history of reckless and unethical behavior, from personal grudges to professional negligence. He once failed to perform CPR when a patient's life depended on it, and didn't even record it in the medical files. By 2022, Raynaldo was under investigation for a serious surgical error that could cost him his medical license. Feeling desperate and cornered, he devised an insane plan to protect himself, a plan that would put dozens of patients at risk. The surgical center kept IV bags in a warming bin for staff to use during procedures. Raynaldo began tampering with these bags when no one was around. He injected dangerous drug, including anesthetics like bupivacaine and lidocaine, turning them into hidden poisons. His goal was clear: to cause other doctors' patients to experience complications, making his colleagues look incompetent while he remained untouched. He carefully avoided affecting his own patients, ensuring suspicion never fell on him. A patient undergoing routine surgery went into cardiac arrest after receiving a poisoned IV bag. She survived, but the chaos spread. Over the next few months, multiple patients experienced sudden cardiac emergencies, some requiring ICU care. In total, 4 patients suffered life-threatening reactions, and another 13 experienced unexplained medical emergencies, all linked to the tainted IV bags. Raynaldo's plan was working exactly as he intended. Tragedy struck when Dr. Melanie, a colleague, took home an IV bag from the warming bin to treat dehydration. That bag was poisoned. Minutes later, she collapsed at home. Despite CPR attempts by her husband, she died from bupivacaine toxicity. This shocking death triggered a federal investigation and raised alarms across the surgical center. Doctors noticed a pattern: cardiac emergencies linked to IV bags from the warming bin. Security footage revealed Raynaldo acting suspiciously around the bin. Forensic testing confirmed needle punctures and drug contamination in multiple IV bags. The evidence clearly pointed to Raynaldo as the cause of the chaos. Ronaldo was arrested and put on trial. He was convicted on multiple counts of tampering with drugs and endangering patients. He was sentenced to 190 years in federal prison, with the judge calling his actions tantamount to attempted murder. The case became a chilling reminder of how one person's wicked act and desperation can threaten countless lives. Trust is the foundation of medicine, but in this case, it was shattered. One doctor's obsession with saving his career put dozens of lives at risk and left a trail of trauma that will never be forgotten. Always question, always observe, because sometimes the danger comes from where you least expect it.